Hello and welcome to Askimo TV. We're talking today to Dr. Prasad Kothari. Dr. Kothari is a consultant ENT, head and neck surgeon in the UK. He has a special interest in head and neck and thyroid cancer, also in sleep apnea and snoring. Hi, Dr. Kothari. How are you?
Very well. Good morning to you.
Dr. Kothari, let's talk today a little bit about head and neck cancer. So what are the major contributing factors for head and neck cancers, and who's at risk?
Head and neck cancer, fortunately, certainly in the Western world, is not very common. In UK, it's about the 6th or the 7th commonest cancer. It is because the head and neck is an area which involves different parts, for example, the mouth, the throat, the pharynx, the nose. The head and neck cancer is what we call a heterogeneous group. So there are different cancers, but they are all grouped together. Different parts of the world have got different cancers which are common. For example, in places like China or in Hong Kong, something called nasopharyngeal cancer is very common. Whereas in UK, we see a lot of cancer of the throat or voice box. Whereas in places like India, we see a lot of cancer of the mouth. And that relates to the various habits people have, genetic makeup, and diet. So there are lots of different cancers with different causes.
Who's at risk for getting head and neck cancer?
Head and neck cancer generally is not seen in children. The people who we see head and neck cancer are usually in their 60s or 70s. We can see them in the earlier as well. It's more common in men as compared to women. But people who are at risk are generally people who have habits which cause head and neck cancer. For example, smoking and alcohol. And if you drink and smoke together, then the risk rises exponentially. So the risk is not double, it's far more than that. Plus, if you have a family history of cancer, the chances are that if you have a family history and if you smoke and drink, your risk is going to be even higher. There are other dietary factors related to cancer, particularly in nasopharyngeal cancer. It is thought to be due to link to the salty fish that is eaten in that part of the world, as I mentioned, in China or Hong Kong. There is increasing evidence now that some of these cancers can be caused by viruses. And it has been proven on studies that there are some viruses called the HPV virus, the human papilloma virus. It's the same virus that causes cervical cancer, is now linked with some types of cancer in the mouth, in the throat.
What are some of the warning signs of head and neck cancers? Some signs or symptoms that may indicate that I should seek out the help of a physician?
Yeah. Because it is a big group, the signs and symptoms would depend on where the cancer primarily is. But some of the common things that people should look out for is an ulcer, for example, in the mouth. An ulcer which is not healing very well within a period of 4 to 6 weeks. Someone should seek attention. And the person to see is either the dentist or a doctor. Because usually if it's in the mouth, the patient would tend to go and see the dentist. If it's a voice box, it's usually a change in voice. Any voice that is not returned to normal after 6 weeks. Because if you get a sore throat or a cold, you will get a hoarse voice, but that tends to get better. But if it doesn't get better in 4 to 6 weeks, then that's something they should seek advice. Difficulty swallowing. Again, if your swallowing difficulty persists for over 6 weeks, then they should seek advice. Head and neck cancer can also present as a lump in the neck. So any lump or a lymph gland in the neck which is not going away, they should seek advice. And there are other signs and symptoms like weight loss or coughing up blood or loss of appetite. With any of these other symptoms, then someone should seek advice as soon as possible.
How is head and neck cancer diagnosed, and what sort of treatment options are available?
The diagnosis of head and neck cancer usually is made firstly on history, asking the patient about the symptoms, how long for, and what exactly the symptoms are. But in terms of specific diagnosis, obviously one needs to look at where the swelling is or where the ulcer is. And if it's a problem with the throat, then the specialist would do a flexible endoscopy, which is a fine camera that goes through the nose into the throat, and we can have a look at the voice box or the throat. It's a painless procedure. It takes literally a few seconds to a minute to do, but it gives us a lot of information. But the definitive test for any cancer diagnosis is a biopsy. Now, the biopsy could be obtained from either the ulcer, or if it's a lymph gland in the neck, then it could be obtained by taking a few cells from it, called cytology. In addition, one may also need to have scanning, either an ultrasound scan or an MRI scan or a CT scan. But the confirmation of cancer only comes from a biopsy when the cells are taken and examined under the microscope.
And how is head and neck cancer treated? Is surgery the only option?
Not at all. Any treatment for cancer, generally anyway, depends on the stage. So if you have early cancer, chances are it would be treated with minimal intervention. So surgery is an option. In head and neck cancer, depending on where the cancer is, for example, if it's a cancer within the voice box or the mouth, it can be treated by surgery, and that would include taking it out with a laser or using a knife. Generally, advanced cancers will need a combination of treatment. So they may have either radiotherapy and chemotherapy as the only treatment, or they may have surgery followed by radiotherapy and chemotherapy, or they may have chemotherapy and radiotherapy followed by surgery. So it depends on where the cancer is, at what stage it is, but also how fit and well the patient is, because not every treatment is suitable for every patient. If the patient is old and frail, they may not be able to withstand the extent of treatment. So for those, the treatment will have to be catered according to what their ability to withstand treatment is. But usually, in a nutshell, we are looking at a combination of various treatment options for head and neck cancer.
And what is the prognosis for recovery?
The prognosis is generally very good if it's picked up early. So if it's what we call a stage 1 or a T1 cancer, then we are looking at a 5-year survival of 80 to 90%. Whereas if it's advanced stage cancer like stage 4, we are looking at a survival of region of 30 to 40%. But if the cancer is picked up early, then the outcome is excellent with adequate treatment. And that may be, as I said, a combination of treatment.
Thank you, Dr. Kothari. Thank you so much for talking to me today.
Thank you.